Those bags under your eyes, you have tried cold spoons, you have tried cucumber slices, you have tried every cream on the shelf. Nothing works. And the reason nothing works is because those bags are not a skin problem. They are not a sleep problem. They are not an allergy problem. They are a kidney problem. And until you treat the kidneys, those bags are not going anywhere. Stay with me, because in the next few minutes, everything you thought you knew about eye bags is going to make a lot more sense. Before we go any further, drop a comment and tell me where you are watching from. I want to know where this is reaching. Drop your city or your country right now and let us see how far this community goes. Now, let me ask you something. Have you ever noticed that the puffiness is always worse in the morning? You wake up, you look in the mirror, and the bags are at their fullest. Then by the afternoon, they shrink a little, and by evening, they are almost manageable. Then you sleep again, and in the morning, they are back bigger than ever. That pattern right there is the clue, and most people miss it completely. If eye bags were caused by tired skin or aging or allergies, they would not follow that pattern. They would not be worse in the morning and better by the afternoon. But kidney-related puffiness follows that exact pattern every single time. And the reason why comes down to one thing, a protein called albumin. Type bags in the comments if your eye puffiness is always worst when you first wake up. Because if that is your pattern, this video was made for you. Here's what is actually happening inside your body. Your kidneys are filters. Not simple filters like the one in your coffee machine. Extraordinarily precise filters that process about half a cup of blood every single minute of every single. One of the most important things they protect is albumin. Albumin is a protein that lives in your bloodstream, and its job is to act like a sponge. It holds fluid inside your blood vessels where it belongs. It keeps the fluid from leaking out into your tissues. Now, when your kidneys are healthy, albumin stays exactly where it is supposed to be, inside your blood. But when kidney filters get damaged, even slightly, even early stage damage that would never show up as pain or dramatic symptoms, those filters develop tiny gaps, and albumin starts slipping through. It leaks out of the blood and into the urine. You have probably heard of this, foamy urine. That foam is albumin doing in water exactly what soap does in water. Because albumin and soap have almost identical chemical structures. Here is the problem. Every time albumin leaks out through the kidneys, the level of albumin in your blood drops. And when blood albumin drops, fluid can no longer be held inside the blood vessels efficiently. It starts leaking out into the surrounding tissues, and because the tissue around your eyes is the loosest, softest, most porous tissue on your face, that is where the fluid goes first. It pools there overnight while you are lying flat, which is why the bags are always worst in the morning, and by the afternoon, gravity has pulled some of that fluid down into the body. The bags shrink, but they never fully go away because the albumin is still leaking every single night. The cycle repeats. Type foam if you have ever noticed foamy or bubbly urine, especially in the morning. Because that foam and those eye bags are connected. They are the same problem showing up in two different places. Now, let us talk about the pressure point. You have probably seen videos or posts about pressing a point to reduce eye puffiness, and there is actually something real behind this. Not magic, not instant cure, but real physiology. The area just below the inner corner of your eye, right along the edge of the eye socket bone, sits directly over a drainage point called the nasolacrimal duct area and the surrounding lymphatic channels These channels are responsible for draining excess fluid away from the eye area and back into circulation. When fluid has been pooling there overnight, those channels can become sluggish. Gentle, firm pressure applied in a circular motion along the orbital bone, the bony ridge surrounding the eye socket, for about 60 seconds can help stimulate that lymphatic drainage and manually encourage the fluid to move. Here is exactly how to do it. Using your ring finger, which naturally applies the lightest pressure, start at the inner corner of your eye where your upper and lower lid meet. Press gently but firmly against the bone, not on the soft tissue, on the bone. Hold for 3 seconds, then slowly move your finger along the lower orbital bone toward the outer corner of the eye. Then come back along the upper orbital bone back to the inner corner. That is one full circle. Do it slowly. Do it 10 times on each eye. Then take 2 fingers and gently press just below the cheekbone directly under each eye and hold for 10 seconds. This encourages the fluid that has been displaced to drain downward and out of the eye area through the lymphatic system. Does it fix the underlying kidney problem? No, but it gives you real immediate relief while you work on the root cause. And understanding the difference between treating the symptom and treating the cause is everything. Type pressure if you are going to try this tonight, and keep watching because the part that actually fixes this long term is coming up next. Now, here is something that surprises most people. The kidneys do the majority of their filtering and repair work while you sleep. While you are lying down, your heart does not have to work as hard to push blood around, which means blood flow to the kidneys increases. Your kidneys use this time to catch up on filtration, regulate fluid balance, and repair damaged tissue. This is why your first urine of the morning is always the most concentrated and the most informative about your kidney health. But here is the catch. When kidney filters are damaged and albumin is leaking, that overnight filtration session also becomes the window where the most fluid accumulates in soft tissues, including around your eyes. You are literally sleeping your way into worse eye bags every night, not because of how you sleep, but because your kidneys are working all night with a compromised filter. This also explains why drinking a large glass of water before bed makes the eye bags worse for many people. Because with low albumin, that extra fluid has nowhere to stay in the bloodstream. It leaks straight into the tissues. The eyes take it first. Type water if you noticed your eye bags are worse after drinking a lot before bed. You are not imagining it. This is the albumin mechanism doing exactly what it does. So what causes the kidney filters to become damaged in the first place? The number one cause is high blood sugar. When glucose levels are elevated consistently over months and years, it acts like fine sandpaper running through those tiny kidney filters. The filters thicken, they scar, and they develop gaps. Protein starts leaking. And because this process is painless and gradual, most people do not know it is happening until the damage is already significant. The second cause is high blood pressure. High pressure physically batters those same tiny filters. The higher the pressure, the faster the scarring, and here is what makes it worse. Damaged kidneys cannot regulate blood pressure properly. So kidney damage raises blood pressure, and high blood pressure causes more kidney damage. It feeds itself. The third cause is chronic dehydration. Not severe dehydration, mild, chronic, everyday dehydration. When you are mildly dehydrated consistently, your kidneys have to work harder to concentrate the small amount of fluid available. Over years, this strains the filtering tissue in a way that quietly adds up. The fourth cause is regular use of common pain medications like ibuprofen and naproxen. These medications restrict blood flow to the kidneys every time you take them. Occasionally, that is manageable. Regularly, over months or years, that reduced blood flow gradually damages the filters in a way that most people never connect to their eye bags, their fatigue, or their swelling. Type ibuprofen if you take pain medications like this regularly and never knew about the kidney connection. This does not get talked about nearly enough. The fifth cause is a diet that is very high in sodium and processed food. Excess sodium forces the kidneys to constantly work to maintain fluid balance. Over time, this creates a chronic low-grade stress on the filtering tissue that, combined with any of the other causes, accelerates damage significantly. Now, let us talk about what you can actually do. What actually moves the needle on kidney-related eye bags over time? The first thing is to reduce sodium dramatically. Not just adding less salt at the table. Looking at every processed food, every packaged meal, every sauce, every canned product. Sodium is hidden in enormous amounts in foods that do not even taste salty. Reducing sodium reduces the fluid retention burden on the kidneys immediately. Some people notice a visible difference in their eye bags within a week of seriously reducing sodium. Not because the kidneys healed, but because the fluid retention pressure dropped. The second thing is to support albumin levels through quality protein. Lean fish, eggs, particularly egg whites, legumes, and tofu. These give your body the building blocks to maintain blood albumin levels while placing the lowest possible filtration burden on the kidneys compared to red meat. You want to feed the system that is leaking without overwhelming the filter that is already strained. The third thing is garlic. Every single day, the compound allicin in garlic reduces kidney inflammation, lowers blood pressure, and protects the blood vessels that feed those tiny filters. Raw garlic is most potent. Cooked garlic still delivers significant benefit. Add it to everything. This is one of the most studied and most consistently effective things you can do for kidney filter health over time. The fourth thing is turmeric with black pepper. Curcumin, the active compound in turmeric, has been shown specifically to reduce protein leakage from the kidneys, which means it directly addresses the albumin loss mechanism that is causing the eye bags. Without black pepper, curcumin absorbs very poorly. With black pepper, absorption increases dramatically. Always combine them. The fifth thing is celery. Celery is one of the most underrated kidney foods that exists. It is a natural, gentle diuretic that supports fluid clearance through the kidneys without straining the filters. It helps reduce the puffiness in the eye area specifically. And it supports healthy uric acid clearance, which reduces the inflammatory load on kidney tissue. Fresh celery juice, or simply eating celery daily, makes a real difference for kidney-related fluid retention. Many people report visible reduction in eye puffiness within days of adding celery consistently. Type celery if you are going to try this, because this one surprises almost everyone and it works faster than most people expect. The sixth thing is to get tested. This is the one people skip, and it is the most important one on the list. A simple urine test called a urine albumin to creatinine ratio, and a blood test called eGFR, which stands for estimated glomerular filtration rate, will tell you exactly what is happening with your kidney filters right now. These tests are inexpensive, they are widely available, and they give you real information instead of guessing. If you have had persistent eye bags for months or years and nothing topical has worked, these two tests could explain everything. Ask your doctor for them by name. Tell them you have had persistent periorbital edema, which is the medical term for eye area swelling, and you want to rule out proteinuria and assess kidney filter function. That exact phrasing will get you taken seriously immediately. Save this video right now before you close it. You are going to want to come back to this before your next doctor's appointment. Now, before I wrap up, I want to make sure you understand something important. Not every eye bag is a kidney problem. Allergies cause eye puffiness. Sinus congestion causes eye puffiness. Poor sleep causes eye puffiness. Aging and skin laxity cause eye bags. But kidney-related eye puffiness has a specific fingerprint. It is worst in the morning and improves through the day. It is soft and fluid-filled rather than firm or fatty. It does not respond to antihistamines or allergy treatments. It has been present for months or years rather than appearing suddenly with a cold or allergy season. And it tends to come with at least one other sign, like fatigue that sleep does not fix, or mild swelling in the ankles by evening, or urine that is sometimes foamy, or blood pressure that has been creeping up. If two or more of those things sound familiar, that is a pattern, and a pattern is what deserves proper medical testing. Type pattern in the comments if you recognize more than one of these signs in yourself right now, because the combination matters more than any single symptom alone. So, to bring it all together, those eye bags that will not go away no matter what cream you use or how much sleep you get, may be your kidneys sending you the most visible signal they can. Albumin is leaking. Fluid is pooling. And the skin around your eyes is just the first place it shows up. Press along the orbital bone for 60 seconds every morning to drain the fluid that accumulated overnight. Reduce sodium aggressively. Add garlic and turmeric with black pepper to your daily eating. Drink celery juice or eat celery every day. Reduce processed food and regular pain medication use. Eat quality lean protein. And get a urine albumin test and an EGFR done at your next doctor's visit. These things work. Not overnight, but they work because they address the actual cause instead of the surface symptom. If this video gave you something you did not know before, please give it a like. It takes 1 second and it helps this information reach the people who need it most. Share this with someone who has had eye bags for years that nothing seems to fix. They deserve to know what is actually causing them. Subscribe and hit the bell. We cover kidney health, fluid retention, blood pressure, and the warning signs your body sends before things become serious, all in language that actually makes sense. And comment below right now. Tell me how long you have had these eye bags. Tell me if the morning pattern matches. Tell me which of these things you are going to start with. I read every comment, and your responses shape exactly what we cover next. And if you want us to do a full video on how to read your kidney test results at home so you actually understand what your numbers mean, type results in the comments. If enough people ask for it, that is the next video. Take care of your kidneys. They have been trying to tell you something. Now you know how to listen.